Recently, we saw the FDA approval of subcutaneous rituximab based upon the Sabrina trial. The Sabrina trial was a randomized phase 3 trial looking at subcutaneous rituximab given 1,400 milligrams as a flat dose versus rituximab 375 milligrams per meter squared with chemotherapy. And the results of this phase 3 trial showed that, remarkably, the overall responses were almost identical, 82.4 versus 82.9%, I believe, in patients with follicular lymphoma using subcutaneous rituximab or infusional rituximab with chemotherapy. The complete remission rates were almost identical, and the progression-free survival at 2 years looking at subcutaneous rituximab versus intravenous rituximab were also almost identical. So to me, the phase 3 trial suggested that either formulation appeared to be very active in patients with follicular lymphoma in combination with chemotherapy. So at our center, we've started using subcutaneous rituximab in combination with chemotherapy and as a single agent. Now, I think it's important to remember that when using subcutaneous rituximab, it should only be done after a patient first receives and tolerates a dose of intravenous rituximab. So the intravenous rituximab is given in the first cycle or as the first dose. We monitor for infusion reactions, make sure the patients do not have a serious adverse event with intravenous rituximab. And then in subsequent cycles with chemotherapy as a single agent, the drug can be given subcutaneously. When we're giving a patient subcutaneous rituximab, it's given in the abdominal wall. We want to make sure you avoid any areas that are hard or indurated or tender. The drug is given over 5 to 7 minutes. Usually we watch patients for at least 15 to 20 minutes after the infusion to make sure they don't have a significant infusion reaction. In the randomized trials, we did see that there was a slightly higher rate of reactions at the site, which is not surprising. It's a subcutaneous infusion. And this was mainly mild pain or redness at the site. And so when monitoring a patient during and after the injection, it's important to look for local reactions. Many times this can be treated with antihistamines or even ice at the site. And in the vast majority of cases, this will be low grade and resolves spontaneously.